morning, everyone. My name's Gail Hecht. I'm the course director for this course today. I want to welcome all of you, the attendees, the speakers. We've been working on this program for about 1 year, so it's exciting to see it begin to come together.
We have very exciting evidence that microbes are important in IBD. There are different patterns in Crohn's disease and ulcerative colitis compared with the normal populations that are fairly predictable, so-called dysbiosis. We are trying to decipher those bacteria that are predominantly protective and those that are predominantly pro-inflammatory, with the hope that we can alter those.
There's massive overlap between metabolic disease, IBD, IBS, so irritable bowel syndrome, and Crohn's and colitis. That's what you see when you hear all the eminent speakers give their talk. So it is all about changing diversity, less short-chain fatty acid producing bacteria, more pathogens. So that's what we have. There's now two things I think we should do. One is to test whether this can be used in the clinic as a diagnostic. So if you sample a person with obesity or with a family history of IBD, can you say you are more at risk of getting this disease? And second is how do we get this adverse microbiome composition, how do we get it back? Is that smart probiotics? Is that giving the short-chain fatty acids? That's something we have to look into now. And that will be the next 5 years, I guess.
There's evidence that each one of these different non-bacterial microbes might play a role in the pathogenesis of inflammatory bowel disease. And even archaea, another life form that lives in the gut, may work together with bacteria to increase production of short-chain fatty acids, which we know tend to be beneficial in that they tend to restore immune tolerance and maybe decrease intestinal inflammation.
Infants are really just developing a lot of their adaptive immunity, and they're also developing their microbiota. So it's a less stable ecosystem because diverse community of microbes is evolving. And the host has less control as well. So any sort of disruption in a less stable ecosystem can have a greater impact. The total impact is affected by the dose and the type of antibiotic, the length of treatment, and the numbers of different treatments.
Fecal transplant represents a real hope for a therapeutic option in the future. However, our enthusiasm really needs to be tempered by understanding that this is still an experimental therapy in most of these conditions, and that hopefully having this treatment available for our patients will come, but that there's a lot of work to be done.
Our gut microbes produce hundreds of neurochemicals that are capable of changing brain function and play a fundamental role in brain development as well.
I just wanted to invite you all. Next year, the meeting will be held in Europe. As you know, this is a meeting jointly organized by the AGA in the Microbiota section of the European Society of Neurogastroenterology and Motility. I hope to see you all next year in Europe. Thank you very much.